Okay, so last time we did speak about the cold and flu and a little bit about COVID as well. So today we're going to be talking about the flu vaccine and the COVID vaccine, your myths, how it works, and anything that we think you will benefit you.
Yes,
Okay?
yes. Um,
Yeah,
we do know that flu and COVID can be a serious disease, but we also know that there's ways to prevent this being, having serious implications on our health, and that is via
that's right.
vaccination. So it is very important, I suppose, to be vaccinated. Vaccination helps prevent a lot of these things, these conditions and
Yeah.
diseases from being severe.
Let's start off by telling you how many times, how often you should have like the flu vaccine, and then we will also go into how the flu vaccine actually works and why you should have it basically to prevent you from having the flu. So Trudy, should we start off with like how many times like a person should get like a flu vaccination, and
Yeah,
also like the sort of groups that should
should
actually be vaccinated? Yeah.
yeah, of course.
Fantastic. So ideally, the vaccination should be done twice a year. So during like the flu season,
Yes.
yeah. And who can have the vaccine, Trudy?
So there's a lot of groups of people who the vaccine is mainly beneficial to. And I say mainly, I mean, of course, the vaccine will be beneficial to everyone, but there's groups of people who are normally at risk of getting a flu. Therefore, the flu
Yeah,
vaccine would benefit. A lot of the elderly people are normally at risk because, of course, they've got a weakened immune system, most of them,
yeah,
and they're not able to fight infections like the younger people would. Therefore, older people would definitely benefit from a flu vaccine every year. And that is
yeah.
why the NHS has normally got a plan of making it free for over 60s. Is it 60s or 65s? But yeah, I think
65,
over
yeah, over
65s, yeah. So
65, yeah.
pensioners can get it for free because, of course, they're at risk of
That's right.
getting a flu vaccine, getting a flu. Therefore, the vaccine will
Yeah,
help with, I suppose, preventing that, preventing it
yeah.
being a severe case of a flu.
Fantastic, fantastic. Another group of people I think will benefit are like people with like long-term health conditions, and also like people with like weakened immune system. So they could be like patients that maybe like cancer patients or patients on some drugs that weakens their immune system. So immunosuppressants like methotrexate, um, you know, hydroxychloroquine, those sort of things. Yeah, like any medications that basically weakens your immune system, it puts you at risk of developing like cold and flu. So anybody on such medications, we do urge you to go for the flu vaccination. People that live in the care home, which Trudy said, like the elderly, but especially people that live in care home as well, are more susceptible getting the cold and flu. So we like the NHS highly recommends that patients living in the care home gets flu vaccinated. Do you know kids can also be get the flu vaccination?
Yeah.
Yeah, and also pregnant women, they could
Yes.
also get vaccinated. Yeah,
And that is a good.
so
I'm glad you mentioned pregnant women because that's another myth.
yeah,
Is people think or pregnant women think, wait, I'm pregnant, I really shouldn't have the flu vaccine, but that
yeah,
is just a myth.
that's right.
Pregnant women, if anything, should actually have the flu vaccine because
Yeah,
their immune systems are weaker, because, you're
That's right.
basically carrying a whole human, so your immune system will be weaker. Therefore, a flu vaccine would be more than suitable for a pregnant woman.
Yeah. Okay. So, how would one like get the flu vaccination? Maybe there's someone there who doesn't actually know like how to get it. Truly, how would one go about getting a flu vaccination?
Well, the flu vaccine is normally introduced. Well, it's introduced in the UK during sort of like the autumn season, therefore preparing for winter. And a lot of GP surgeries will normally offer flu vaccines to most of their patients. So you can actually get the flu vaccine from your local surgery. If you ring your surgery, they'll be able to tell you if they're maybe going via groups, or if they're going via certain, I suppose, certain age groups or things like that. They'll basically be able to tell you if they are able to offer a flu vaccine. But also,
Okay.
your local chemist or pharmacy will more than likely be doing a flu jab service. Therefore,
Yeah.
around sort of like the September, to be honest, end of August, if you speak to your
Okay.
local pharmacy, they'll be able to tell you if they will be doing the flu jabs that year. Um, those are the two places that you will more than definitely get a flu vaccine in the UK.
Should we also explain like how does the flu vaccination work? You know, and basically what it does to you in your body.
Yeah.
Yeah. So with the flu vaccination, the way I like to explain it is that it's like they the way they come about it is like a weather system basically. They predict they predict which virus is gonna come about in the season. So it's like predicting the weather.
Yeah.
So maybe like they think this virus is gonna be pretty like dominant in this season. So let's make a vaccine for it. So that's how they do it,
Mm-hmm.
and then they manufacture the vaccine, and then once the flu season comes, that's why sometimes some patients will be like, oh, I've got the flu vaccination, I've got the vaccination, but I've still got a flu. Maybe at that season the the vaccination that they predict, the virus that they predicted was actually not the one that was prevalent.
Mm-hmm.
It wasn't the one that was dominant. Yeah, so that could be the case. So it's like predicting the weather. Basically, is you're not gonna be 100% sure, but you know,
Yeah,
yeah, it's like a lottery as well.
it
Yeah, so
is.
that's how like the flu vaccination is. Yeah,
It
so they
is.
predict that, and then when they form the vaccine, so what this this does is that they inject it in you. Is and it makes your body produce like antibodies, so things that would help you fight the virus.
Mm-hmm.
So if you were to get the virus, your body would already know that, oh, this virus, I know what to do. So it will produce something to fight off that infection.
Mm-hmm.
So that's when you're not likely to actually fall sick for longer, or your symptoms are not as severe because
Mm-hmm.
like your body's fighting it. So that's what the flu vaccination does.
It is.
Yeah.
It is worth noting as
That's right.
well, I suppose, that the influenza virus changes or mutates
Yes.
every year. Hence, why it is advisable to get a flu vaccine every year, because the
Yeah.
influenza virus that was there last year has possibly mutated and it's not the same
That's
virus
right.
as there is this year. And that is very similar to the COVID virus, which
Yeah.
again mutates. It's just what happens
Yep.
with viruses. They do mutate. So the COVID virus that was there last year has certainly mutated, and it's not the COVID virus that's there this year. Therefore, that's why you have to have the booster. And in
Yeah.
the flu department, It's why you have to have your flu jabs every year. So
Yeah.
every year, both the COVID and the flu vaccine will mutate, and therefore, the flu and the COVID vaccine will have to be manufactured. I suppose just individually every year, just
Mm,
to accommodate that mutated virus.
that's
And
right.
this is very, I think it's very important that they do it this way, because it's the sure way to make sure that your immunity is able to, your immune system is able to fight that specific virus at the time.
Yeah.
And I'm glad you mentioned the way, I suppose, the way the vaccine works.
Mm,
It is exactly that. It is just to do with the antibodies. Once you have the vaccine,
mm,
it stimulates antibodies in your body, and this is literally with every vaccine, isn't it, Stephanie?
that's
When
right.
you get any vaccine, normally what happens is you get a vaccine. And we're talking literally any vaccine, chickenpox, polio, every single
Mm-hmm.
vaccine. It does stimulate antibodies in your body, and what that does is it almost like makes your body develop immunity to that disease or of that virus without having the disease first. So it's like your body is already prepared so that it doesn't have to have that disease because it's already got activated antibodies.
Mm, fantastic.
Now,
Fantastic.
what are some of the myths, Steph, that you've had about not just the flu vaccine, but also the COVID vaccine?
Okay.
Especially the COVID vaccine, because when the COVID vaccine came, we all know that there was a lot of talk and a lot of um, apprehensiveness about getting it because people were saying there was
Mm.
all kinds in this vaccine. But what are the myths that you've had?
Most of the time, the vaccine, like, when people say, oh, they're going to get a vaccine, they feel like that vaccine is actually going to give them that disease. So most of the time, people say, oh, the flu vaccine can give me the flu, or like the COVID vaccine could give me COVID. But what they need to realize is that with the flu vaccine, it doesn't contain like the live vaccine. So the virus is actually not
Yeah.
activated. So yes, you may feel a bit feverish. Like I was actually, we will talk about the side effects of like the vaccine, but the reason why people say, "Oh, it can give me a flu," is because you feel feverish and a bit achy after that. But that
Mm-hmm.
is just a side effect of like the vaccination. It
Yeah.
doesn't necessarily mean that like you've got the flu. It's just like your body actually reacting to the vaccine. It's just a normal reaction. That's why you feel the achiness, the feverish. That's just it. And they usually just last for like a day or two. Unlike if it was a flu where it would last for longer, like for 7 to like 2 weeks. So that's a myth. I normally hear that, oh, the vaccine will give me like flu. Yeah. um, yeah, there are a few things as well. Um, some people say, oh, the vaccine can cause severe side effects. Um, to be honest, let's talk about like the side effects of like these vaccines, and then we can dive into whether these vaccines can cause severe side effects.
Mm-hmm.
Um, so one thing that you should know, as I mentioned, the vaccine, because it's been injected in you, you will have some soreness around the place where it's been injected.
Mm-hmm.
So that is normal. You will have slightly raised temperature because your body is being stimulated to produce a reaction. So which is normal. Your temperature will be raised slightly. And as I said, you will have an achy body because it's just your body working. There's some reactions going on inside. So that is all normal. It's some people do say that they do have severe side effects. But one thing I have noticed, they said there's like 1 in a million that are like they develop a severe side effect, which is um, GBS, Guillain-Barré syndrome, and it's so rare, and that is like the most severe side effect that can happen, where like it causes like muscle weakness and paralysis.
Yeah.
So that is the only like severe side effect I can think of. Unless the other thing I can think of is that some people it does call like anaphylaxis, where maybe they are allergic to it. That is the only severe thing I can think of. Um, but something that people should be aware of, with the flu vaccine, it is made from egg, it's grown in egg. So if you have an egg allergy, it is something to be noted, and do let like the medical staff know that you're allergic to egg.
Yeah.
So that's when they would advise you whether you should have it or not. So egg allergies, that would probably cause an anaphylactic shock. So
Yeah.
do check your allergy status. Yeah.
Yes.
What about you,
Well, it is
Trudy? Have
also
you?
it's also worth noting when it comes to the egg allergy, there is a flu vaccine that is not doesn't have the egg
Egg.
extract. Yes, therefore
Yeah.
it is very important, as Stephanie said, that you mention
Yeah.
if you have an egg allergy, if you have any allergies at all,
Yeah.
just so this can come on your records as well, and also just so you're given the other alternative that you will obviously
Yeah.
not react to. Um, Now there is, as you said, like injection site pain or redness. That's normal. It's a foreign object going into your muscle. Therefore, you're
Yeah.
likely to actually feel the pain and maybe get some swelling. Um,
Yeah.
but sometimes you might also get like sort of like flu-like symptoms. Again, it's just because of your body. Your body's just your body, the antibodies being activated and stimulated. Your body is it's almost like it's this foreign object, coming to your body. Your body's trying to fight it as well. So it's like because of this, your body trying to like do all these things, you will almost like be a little bit immunocompromised. So you'll feel like the whole, flu-like, symptoms, shivering,
Hmm.
just not quite yourself. But
Yeah.
as Stephanie said, it's only going to last a day or two, and you'll be back to normal. You'll be back to yourself. So, and you'll be sorted for months. Therefore, it is important that if you can sort of just get through the 2 days, and you can just tolerate the side effects that you could possibly get with the flu vaccine or the COVID
Mm.
vaccine, do that, and just have the flu and the COVID vaccine. Now, not everyone, however, gets these side effects. There's actually people
Yeah.
who get the flu and the COVID vaccine and they're fine. Like no pain on
Really?
the, like, I mean, the initial pain, yes, but after that, they're fine. Like no
Yeah.
swelling, no redness, no, there's no fever, there's nothing. So again, everyone is different. Side
Yeah.
effects are not things that will always happen or will are guaranteed to happen. They can potentially
Yeah.
happen. So these are just warnings, just so you're aware that when you have this could potentially happen, but it's not a
That's
given.
right.
Now that is it's weird that the flu and the COVID vaccine is so similar, but they're different as well. Like the vaccines are very different in terms of like
Yeah.
them being aimed at different viruses, but the side effects that you get with both of them are very, very similar. So the same side effects that you would get with, say, the flu vaccine, you're more than likely to get with the COVID vaccine. So the achiness, the mild flu-like symptoms, the sore arm, at the injection site,
Yeah.
just feeling not yourself, feeling sick. But I think it's also worth noting that if your side effects or the symptoms you're having are quite severe, you should seek help. Sorry,
Definitely.
you should call 111 or 999 and just explain to them some of these symptoms or side effects that you're experiencing, because something that you might just be like, oh, it's just a symptom or a side effect of the vaccine, could actually end up being quite serious. So if you feel like you're experiencing a side effect for one a lot longer than a couple of days, it's been a week and you're still feeling shiverish
Mm,
and you're not feeling yourself, it is worth seeking help. It's worth seeking
that's right.
advice from a healthcare professional, just to make sure that you're okay, that you're not reacting to the vaccine in a way that you shouldn't be.
That's right. That's right.
Another
Brilliant.
myth that I've heard is
Yeah.
normally that the the vaccine is not,
Hmm.
or like the flu is not bad enough for someone to get a vaccine. Like someone, I've had someone say, "It's just the flu. It's not that serious. I don't need a vaccine."
Oh yes,
You know,
yes, yes, yes. I've heard that. Yeah, they don't think the flu is serious enough for them to need a
a
vaccine.
vaccine
Yes, we hear that all the
all
time.
the
We
time.
hear that all the time, but they don't. People don't understand yet. Flu used to kill people back in the days.
It
Yeah, I know
still
things
kills
have
people,
changed.
Stephanie.
It still kills. I know it does. It still kills people, but now people are a lot more aware of it and use it, like having the flu vaccination, which has been preventing the deaths, like the seriousness of the illness. But people still downplay it, that it's not as serious, but it really is, especially like people with like respiratory diseases, people with low immune system, like it can make them so vulnerable and really escalate if you get a flu in these sort of patients.
Yeah,
Like even the normal person, things can really escalate quickly.
yeah,
And you may think, oh, it's just a flu, but trust me, it can escalate quickly where it could cause a lot of complications to like maybe your heart, your lungs, your brain. Like if it causes pneumonia, all of that. So please do not downplay the flu. Do not downplay it. That's the reason why they've actually done a vaccine, because it is a serious illness, which
yes,
should tell you that, maybe I should get the vaccine. Like the
exactly,
fact that they've actually developed it.
exactly.
Yeah.
The flu
But that
is,
is a myth I hear a lot.
it is serious. It
Yeah.
is certainly a very serious
Yeah.
virus. Um, there's a lot of people will recover within weeks of getting it, a couple of weeks, and you're like back to your old self, you're fine, you get back to work and all of that. But a lot of people will develop a lot of conditions on top of this, so a lot of
Yeah.
complications, including like sinus and ear infections, pneumonia, heart and brain
Mm.
inflammations. And of course, if you're having a heart and brain inflammation, that could lead to the worst. So it
Yeah.
is very, very important not to, as you said, Stephanie, not to downplay the flu. It is a serious virus. It is a serious
Yeah.
disease, and therefore, a vaccine is actually is necessary.
That's right. Yeah. 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 And I don't know if we touched on this, like where people say, "Oh, I had the vaccine, but I still got the flu." So that's what stops them from getting another vaccine.
Yeah.
Than like maybe in the winter time, because they've had it previously, but then they still got a cold, like they still got a flu,
Hmm.
or they had a cold or some sort of symptoms, and they feel like, oh, the vaccine did not work. So what's the point of like carrying on with it? But as we mentioned before, like the virus mutates all the time, so the strain changes. So yes, perhaps like you may have had the flu vaccine 1 year or one term, and you may have developed some cold symptoms or sort of flu-like symptoms. That's because maybe the virus at that time had mutated, so the vaccine was not as effective as it would have been if it was the same, if it was the strain that was predicted. But this shouldn't deter you from actually getting the flu
Yeah.
vaccination. As I said, the strain changes all
It
the time,
does.
but once it is predicted
Hmm.
right, it is going to protect you, even if it's not the right strain predicted. The strain that has been put on the vaccine, it's still very close to whatever strain is circulating, so you still get some sort of immunity. So please do not say, oh, because I've had the vaccine and I've got a flu, it doesn't work. It does work. And usually when you get the flu, when you get the flu whilst you've been vaccinated, you do find out that your symptoms is not as severe as if you hadn't been
Yeah,
vaccinated. So
that
that is something you should
definitely. And
consider.
it's one of those as well. If there's different flus that's circulating, of course, if you've been vaccinated against, say, one of the strains, you will certainly get the flu that is that maybe you've not been vaccinated against, or is not in your vaccine.
Take home message.
So, in regards to the vaccines, my take home message is that if the COVID and flu vaccine is offered to you and you're eligible to have the COVID and flu vaccine, I would highly advise that you consider having it. If not for you, it would be best to have herd immunity, because that is safeguarding the people around you who might not be able to get the vaccine, maybe because of certain conditions or allergies, they're not able to get the vaccines. And let's just remember that when it comes to health, it is the foundation actually starts with you, and then it kind of spreads to the community. So if offered the COVID and flu vaccine, highly recommend that you go for it.
Yeah. Yeah. I totally agree. Totally agree with you. I mean, like, there are so many myths out there with anything, including like the vaccines. If you say you're gonna really read into all these myths, sometimes you may not make a decision or you may make the wrong decision. So, although there are myths about these vaccines, just make sure that you do your research. As we always say, with everything, make sure you do your research, make sure that you've gathered your information just to give you a proper information, like give you all the details that you need to make your own decision. So there are loads of myths as we mentioned, but please do make sure that you do your research and you can make your own decision. As I sometimes say as well, it's better to be safe than sorry. So make sure that you take the right precautions to prevent you from having these diseases or to prevent you from spreading it or making it worse. I mean, if you know you're a person who is vulnerable, or like you've got a vulnerable immunity, and do consider these things. I'm not making that decision for you, but look into it. If you feel you will benefit from it, do by all means go for the vaccine, because you know you never know, that could actually prevent you from having some complications of these diseases, or not even getting it at all. So do consider these things. Yeah,
Definitely.
and as we always say as well, make sure you protect yourself, do the right things. If you know you have a cold or a flu, use a tissue to dispose of your sneeze, your bogey, so that it decreases the spread of these diseases.
Yeah.
If you come back from work or from anywhere, make sure you wash your hands. These are the little things you can do to prevent you from having a cold and flu.
Yeah.
And as we're aware, with these vaccines, they do produce it for a good reason, because it was killing like a lot of people. So if I were you, look into it, gather all your information, and if you feel you will benefit, go for it. If you feel it's not for you, by all means, don't go for it. But make sure you
That's
do
it.
the right research, right?
That's correct. That's correct. But also, it's very
Yeah.
important, I think, to remember that when you have the flu and COVID vaccine, it doesn't necessarily guarantee you 100% immunity from the flu or COVID. So this just means that if, say, you were to get COVID or the flu, it will somehow reduce the severity of the symptoms of COVID and flu. So if if anything, you're actually helping your body, because what happens is when you have a disease, the severe the symptoms, the harder your immunity and your body's having to work. So you are actually helping your body, that your immune system doesn't have to work very hard to try and sort of like resolve some of these things. So very important to remember, the cold, the flu and the COVID vaccine is not a guarantee to zero disease, but you're basically reducing the severity of how bad this disease can be. And it's very important as well to remember that your health is basically the foundation of a thriving and a healthy community. So if you're healthy, if you've had the vaccine, you've protected yourself, you've protected someone else. As I said earlier, it is all about herd immunity. So you're protecting someone who might not be able to protect themselves, but also together we're all building immunity against something that could actually be very, very deadly.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week.